That's an important question. The question is, why is multifocal motor neuropathy misdiagnosed as an entrapment neuropathy? And the reason is mainly because of how common is entrapment neuropathy compared to multifocal motor neuropathy. Multifocal motor neuropathy is a rare disease. It's not seen commonly in a busy neurologist office. And because a typical neurologist has little exposure to MMN or multifocal motor neuropathy, it's missed quite often. Most of the time it's missed initially in the early phases because it can be very tricky to make the diagnosis initially. However, there are certain cardinal points of multifocal motor neuropathy. It is painless and slowly progressive, whereas entrapment neuropathy tend to be associated with pain and almost always with sensory symptoms and signs. Multifocal motor neuropathy rarely present with sensory symptoms, and if they do have sensory symptoms, they're really very vague and not in the distribution of the affected nerve. The consequences of the late diagnosis of MMN are quite immense because it's so important to diagnose MMN early on and to treat it as soon as the diagnosis is made in order to retard progression of the disease and development of progressive muscle loss and atrophy. And the basis of that is the pathophysiology of cumulative and ongoing axonal loss that occurs if MMN is not treated and recognized. There are studies that have been published already back in 2002 by Vanderberg-Voss, and then a cross-sectional study that was published in 2009 by Katz and Pipers, where they analyzed, the last study, they analyzed 88 patients. And they, using logistic regression analysis, multivariate analysis, they found that correlates of worse prognosis is number of years untreated and years of IVIG treatment. So it's really crucial to treat it early, diagnose it early, treat it early to prevent axonal loss and to prevent the burden of the disease from further accumulating. Again, there are cardinal points to distinguish MMN from entrapment neuropathy. Clinically, entrapment neuropathy occur at common entrapment sites. Common entrapment sites are like the carpal tunnel at the wrist for the median nerve, the ulnar nerve at the elbow, and in the lower extremity, the peroneal nerve that results in foot drop. Entrapment neuropathy associated with pain, sensory symptoms, and signs, and occur in individual nerve, like either the median or the ulnar, whereas multifocal motor neuropathy occurs in multiple nerves. Although it starts in one nerve, it evolves to involve other nerves, and the distribution of the deficit could be also in branches of the individual nerve. For example, in the radial nerve, where patients who develop radial neuropathy from multifocal motor neuropathy, patient may have differential weakness of finger extension. Not all the fingers are affected equally. Certain fingers are affected, others are spared. And that's a very characteristic clinical points in MMN. MMN is painless. MMN, there are no sensory symptoms or signs.